According to a recent World Bank report, research shows that small differences in context, convenience, and salience have large effects on crucial choices, such as whether to send a child to school, prevent illness, or save to start a business. That means development practitioners need to focus not only on what interventions are needed, but also on how they are implemented. That in turn requires implementing agencies to spend time and resources experimenting, learning, and adapting during the intervention cycle. The last 4 years, MIR has produced evidence on the effectiveness of its practices for leadership, donors, development practitioners, and a public audience. We've been asked to share how we did it. Here are the 6 elements we would like to share with you. It all started with a leadership imperative, a burning platform that everyone was asked and expected to support. We allocated 3 critical elements towards success: time, budget, and space, all critical to enable people. Space became particularly important. We focused key technical staff in the region and gave them new roles as learning hub leaders. In these new roles, we made them accountable to build evidence on the effectiveness of our practices and to become active partners with national offices in the field and not simply advisors working from a distance. The new roles enabled them to really focus on this work of building evidence. Building evidence became mandatory. It became a part of national directors' performance reviews as well as those of the regional development, learning, and impact team. To help make this easier, we reviewed the package of materials regarding what we are accountable for and to whom, and worked to simplify everyone's reporting responsibilities by cutting out that which provided little value. We focused on output and outcome level reporting rather than reporting on compliance to a process. We also developed products that could speak to multiple audiences, which gave us efficiency and cost savings. Let's take a look at how we did this using our Evidence for Change series. As you can see, each chapter was developed with a different audience in mind to enable each audience to have quick access to the most pertinent information for their role. So while the whole document is useful for a field practitioner, other key roles can make use of specific chapters. For example, a leader can learn what he or she needs from the executive summary, including a summary of key evidence in an opening infographic. A grant writer can also use the same information, but also has access to the theory of action, which quickly enables them to write the technical approach for a grant application. We also developed a 4-page summary for donors and other external audiences. The second key component was to develop the mechanism for building evidence. We implemented the Learning Hub approach, which enabled us to call out the evidence agenda and name it something different. Names help people to adjust to new identities and new accountabilities for learning. We developed a research and development framework. Following LEAP alone does not lead to evidence of impact. Building evidence requires a more intentional analysis of what data is needed to answer the question of World Vision's contribution to change. The research and development framework is based on globally agreed standards of effectiveness, such as BOND. This process is being incorporated into national office design, monitoring, and evaluation systems, so it becomes business as usual and works in grant contexts. Third, we needed to ensure that people had the right skills. We hired a research specialist, not program officers, who actually understood the process by which to identify the right indicators and the right methodologies in order to establish causality and to have the right level of rigor to validate our approach. We literally called the position Evidence Building Manager. This research specialist was then able to train others in the learning hubs and in our national offices. As more regional staff understood and partnered with national office colleagues became excited and started to apply these practices in their own national office work. This experience of working new methodologies to build evidence, coupled with other regional support and national office initiatives, helped to improve the quality of MIR's child well-being reports. A country like Pakistan moved from a yellow score of 50 in FY13 to a much improved green score of 82.8 in FY15. Jerusalem, West Bank, Gaza moved from a score of 70 in FY13 to a score of 93.1 in FY15, earning them the rank of number 3 in the overall partnership. While countries like South Caucasus and Albania and Kosovo had high-ranking partnership reports in FY13, their overall quality scores were still low, meaning that World Vision's quality of evidence was not high in terms of external validity in the eyes of donors and peer agencies. Adoption of new practices, however, enabled each to move to a quality score of 96.6 in FY15. While this earned them the number 1 and number 2 ranked reports in the partnership, more importantly, it earned them greater credibility in the external market. Their evidence will stand up to scrutiny. Fourth, we followed up and sought to institutionalize by placing the right business processes in place, such as a 4-stage evidence roadmap, evidence-building plans, developing a beneficiary typology so our region would speak consistently with one voice, and establishing an evaluation improvement mechanism. The evaluation improvement mechanism is important because to improve our evidence base further, our greatest challenge is to improve the quality of our standard data that is generated and emerges from our design, monitoring, and evaluation systems. If we can improve the quality of baselines and evaluations, then it will improve the data and therefore strengthen the claims we make on contribution to child well-being. Fifth, and one of the most important, not to be forgotten, is we focused on culture change. While standards are important to enable us to strengthen and manage accountability, World Vision often finds that in our organizational culture, standards quickly become compliance tools, and unfortunately, staff tend to move through them like robots and miss the critical thinking and linkages that underpin them. While standards are important, we cannot allow them to take the place of critical thinking or staff using the expertise for which we hired them. So we challenge staff to think on their own, not simply implement a process or complete a template. The evidence-building plan actually forces you to think about the connections often missed when we use log frames alone. By doing so, we tried to unleash people's knowledge in their roles. We celebrated positive examples, particularly when a validated practice helped to win a grant, so people would realize the value of the tools and the approaches. And we gave them time to learn and time to do things differently. We exposed staff to new methodologies, which got them excited and built momentum. And we stopped working in silos. Work became shared across sector teams with shared objectives. We also pulled technical staff closer to DM&E staff, sometimes under the same line manager. They worked together on their overlapping and shared accountability for evidence. This was and is a key culture change. Building evidence requires multi-sector, multifunctional work. You cannot have evidence without close collaboration and work between these two groups. And you cannot refine the right practices to have impact without being grounded in the geographical context. Sixth and finally, we brought visibility to the work. We established common type, content, tone, and design for all the products for branding. We started using the evidence we have for impact and influence, as well as for income, including public engagement. The evidence of child well-being outcomes have informed grant acquisition, technical program designs, and management decisions. And we featured these products on an external platform. If you look at the publications on this platform, you will see some of this evidence that enables us to validly make claims on the effectiveness of our practices because we can substantiate the claims with rigorous evidence. Here is just one example. Through the health practice time-targeted counseling implemented in the West Bank, 42% more households are exclusively breastfeeding than in the control group where World Vision did not have this intervention. Breastfeeding is a practice that reduces under 5 deaths by 13%. And this intervention only cost $120 per household, which is a cost 7 times under the World Health Organization benchmark for cost effectiveness. It's been a lot of hard work, but we have done it by working within the partnership's various frameworks and to complement World Vision's existing systems. And we know we're not done yet. We still want and need to integrate evidence-building plans and standard national office design, monitoring, and evaluation practices, including in LEAP processes and documents. but in a simple and clear way so it is not lost in the complexity of the multi-layered LEAP 3 system. We still do not have the right monitoring system either. Horizon does not yet let us record non-registered child beneficiaries, which means World Vision misses out on reporting some of its impact or creates extra work, cost, and challenges for national offices to understand overall programmatic impact. Gender analysis remains a challenge too, and we're not yet using it as a lens for program effectiveness. And not all of our grant proposals are using the evidence-based practices from our region. But the good news is that it is possible to develop an evidence culture. And we hope you see how you might be able to apply these principles into your context. So just to recap, the principles are: make evidence a burning platform, hire staff with the right specialist skills, develop the systems and culture needed, simplify workspace and clear out that which does not add value, create an environment and structure that enable context-knowledgeable, multi-sector, multifunctional teams to work together across regional and national offices in consultation with other partnership stakeholders. So technical, operational, and design monitoring and evaluation staff are building evidence together. Move to an evidence-based management culture and system for all staff. And make the space available to take risks, to have intelligent failures, and to be outward focused. Thank you. For more information, visit wvevidenceforchange.org or contact Mir DLI at wvi.org.